Good evening, everybody. I am Sanya from Prostate Wellbeing Team. I am sure all of you must be keeping good health. Today, we are going to discuss a very important topic that is UTI, urinary tract infection. Urinary tract infection, UTI, is one of the most common health problems for which patient seeks medical care. It is a bacterial infection anywhere in the urinary tract. The urinary tract make and stores urine and remove it from the body. Parts of the urinary tract include kidney, uterus, bladders, and urethra. A doctor can treat this condition and help the patient to get relief. To throw more light on the subject and guide us on what's right for diagnosis and treatment of UTI, today we have with us a renowned nephrologist, Dr. Ratan Jha. Dr. Ratan Jha, DNB MD DTCD gold medalist, FISN. He has a rich experience and hands-on expertise in managing renal transplants, dialysis, and hypertension, as well as treating kidney diseases problem. He is currently practicing at Care Hospital, Hyderabad. Dr. Ratan Jha has a rich experience in the field of nephrology and carries out the diagnosis and treatment with utmost precision and efficiency, ensuring that patients' health is in safe hands. Doctor, we welcome you today.
Thank you.
And as we are going to discuss a very important topic that is UTI, my very first question to you is that what is basically UTI? How we can define UTI?
Urinary tract infection, as the name implies, is infection of the urinary tract starting from the kidney down to the level of urethra, and is associated with certain symptoms and signs, and has to have a kind of a proof that the infection is because of bacteria by a urine culture. So symptoms and signs pertaining to the kidney in the form of fever, dysuria, urinary frequency, hematuria, along with the culture proof, the urine culture proof of bacterial presence is defined as UTI. Many times we have the urine report being abnormal, but patient has got no symptoms, and that is called an asymptomatic UTI or asymptomatic bacteria. So we try to make a diagnosis of UTI when the patient comes with some symptoms or comes with some report where the reports are abnormal, and we feel that this is possibly because of urinary tract infection. So symptoms, signs, and clinical setting is required to make a diagnosis of UTI. The commonest symptoms are frequency, means more frequently passing urine. Urgency means not able to hold urine, and dysuria, that passing with pain, etc. when the urine is there. So the most characteristic symptom is that all the three things should be there together to make a diagnosis. That person will pass urine small amount, patient will have a lot of pain, and patient will not be able to hold the urine. In absence of all the three symptoms together, the diagnosis of UTI may not be a UTI. It is just a kind of lower urinary tract symptom, and which is commonly misdiagnosed as UTI in real practice. Many people get the treatment for trivial symptoms pertaining to the urinary tract, thinking that it's a UTI, but that's not a UTI.
Okay, so these are the major symptoms of UTI, as you told us that passing urine frequently and not able to control the urine. These are the major symptoms of UTI.
Yes.
Doctor, how one can, go to a doctor as he or she can indicate, that these are the major symptoms of UTI and he or she needs to go to a doctor.
So whenever a patient has symptoms which pertains to the bladder, which is usually frequency, urgency, and incontinence along with pain, or fever along with any of these symptoms, one should consider the possibility of UTI, because urinary tract infection is the second commonest broad group of infection after the respiratory tract infection. So it is a common disease, and when you have this kind of symptom, you need to consult a doctor to be sure that this is a UTI, true UTI, or a pseudo UTI, mimicking like UTI but not a UTI, where antibiotic therapy may not be required. One of the common symptoms of severe pain while passing urine is concentrated urine. When the person is having fever, not taking enough water, urine becomes concentrated, and that gives a feeling as severe pain with UTI-like symptom, but may not be a true UTI. So whenever you have a doubt with symptoms pertaining to the urinary passage or urine passage, or pain in the back with fever, you should think that it's a UTI. Consult the doctor. He will confirm it whether it's true UTI or a mimic UTI, which is not a true UTI.
Absolutely, absolutely, doctor. And sometimes, doctor, people also ignore the symptoms and do not treat UTI or self-medicate. If some
Yeah.
their friends or family suggest that I also have UTI and I had a lot of water or maybe instant this medicine. What is your suggestion to the people who self-medicate UTI or take advice from the internet or their family or friends and take over-the-counter medication?
That's a very common thing. Now people are using more of a artificial intelligence because the Google platform is an artificial intelligence. We have symptom signs and suggestion that is there. So people are utilizing that. That may be a appropriate way for taking care of the minor symptoms, but may not be the right way to treat urinary tract infection, which could sometimes be uh, producing a lot of complication, particularly in pregnancy. It is said that in certain high risk situation, if the UTI not treated properly, it can get complicated, like diabetes, patient who are elderly, so who are having other kind of comorbidities. The symptom of signs and symptoms of UTI needs to be treated, pursued aggressively, etc., in a proper way. Many times, the drugs that people take on their own are drug resistant kind of UTI, which may not work at all. Because there has to be an idea which drug will work. With the increasing misuse of antibiotics, we find that the antibiotics are not working the true UTI, etc. So one has to use antibiotics with caution. And not every symptom requires a treatment with antibiotic. Many people demand that some antibiotics will be given if they have burning, but that may not be required. One has to reassure them that without even antibiotics, people's symptom can get better. So this is the other extreme where people demand some antibiotic for every symptom pertaining to the urinary tract, thinking that is a UTI and that is required. Most common cause of dysuria is spicy diet, less urine, and a lot of non-veg, which is again an acid-producing kind of substance in the urine. These are the things which I find commonly where patients have a lot of burning in passing urine and they start taking antibiotics based on the friend's advice that this is a drug that works, but that may not be required. So one has to use drugs with discretion. Every drug, if used properly, is a drug, and if it is used improperly, is a poison. There's not much difference between drug and poison.
Very well explained, doctor, that how people should take medicines. And doctor, you've also talked about that, when people eat spicy food or some kind of food. So are there any, proper causes of UTI, drinking less water or eating or, as you mentioned, taking medicines as well? And are there the causes different?
Understand that there are many symptoms which mimics like UTI, particularly a kind of taking less water with a concentrated urine. That is one of the commonest thing. Second thing is obstructed urinary the system. That is because of say prostate enlargement or some other kind of obstruction in the urethral urethral stenosis. But the people may have difficulty in passing urine, pain, etc. So obstruction, stone disease, any kind of stone with the crystals come in the urine can give a lot of pain, etc. That is there. So these are all mimic UTI where you have concentrated urine, stones, obstruction in the urinary passage, and sometimes certain drugs which are acidic, like if you are taking a kind of food which is acidic, like a lot of non-veg produces a lot of acidic urine, etc. It is so that can give, because everything has to come through urine. Whatever is not required in the body is removed through the efficient system of kidney, which is a kind of washing machine which is working 24 hours. It tries to remove whatever is not required in the body, and that comes in the urine. So these are the things which can mimic like UTI. Many times what happens in the elderly people, they are not able to control urination because of the stroke problem, and they keep on passing urine more frequently, and people think there's a UTI that is there. They're passing many times urine in the pads because they're not able to control urine, and they give the urine sample for some testing. Something is grown in the urine and they start thinking UTI. So whenever you think about UTI, you see, is it the right symptom? Are you investigating correctly? Is the patient having a risk factor? To decide that it requires a treatment. Commonest cause of burning the urine is concentrated urine. Like in a kind of summertime, if people are taking less water, urine becomes yellow in color, etc. And that it means concentrated urine, and that is acidic urine will have pain. Second common thing is stone disease, which mimics like UTI many times, and that is given wrong treatment as with antibiotic. And third is an obstruction, like prostate problem or any other kind of obstruction in the urinary passage can give a symptom like UTI, but not a true UTI. So it is pseudo dysuria, that is difficult in passing urine, and a true kind of urine infection is, along with pain, will have small amount of urine, sometimes blood in the urine, and intra-umbilical pain. And if the infection spreads out, it produces fever. That is usually called urosepsis or a pyelonephritis. The kidney is getting inflamed with pain in the back.
Right. Very well explained, doctor. And doctor, here one more question arises that, is there any age group, which have more often UTI? What are the people, who are more likely to have UTI, or I can say which people are the risk factors of urinary tract infections more?
It is said that at the extremes of ages, the UTI could be more common, like in the elderly, because of the obstruction of prostate, or the very young people where the urine system may not be well developed with some kind of abnormality in the development, like VUR, it can have UTI. And UTI are more common in females compared to males because the urinary apparatus, particularly urethra, is very small and very in close contact to the rectum, which is the fecal area, which can get contaminated. So females are usually having more risk of UTI in the age group in the reproductive age group. But after the age of say 50, males are equally having a risk of UTI because prostate becomes a problem. In the younger age group, it is said that you may have UTI both in males and females because of the developmental abnormality. So UTI in general is the commonest type of infection in females, and it is a lower urinary tract symptom. That is called uncomplicated UTI cystitis. When we talk about UTI, we try to classify UTI as a upper tract, that is kidney, or lower tract, which is bladder, urethra, prostate, etc. that is there. So lower urinary tract symptoms usually don't produce fever. They are only producing symptoms of lower tract. But upper urinary tract, whenever it gets inflamed, it produces fever. So when you have symptoms of UTI and fever, you think it's an upper urinary tract infection, pyelonephritis, and it will require a longer treatment of maybe 7 days compared to lower urinary tract, where the treatment is for 3 to 5 days.
Okay, so these are the different age groups which likely to have more risk factor UTI, and you mentioned that is women are more likely to have UTI, and a lot of women don't use public toilets as well because of UTI cause that it can harm. So here's come a question that is UTI treatment is easy? How can it be treated? And if sometimes when people have first time they have UTI, what is your suggestion to them? Because as you said that the causes are pain and sometimes blood also. So is UTI a treatable infection?
I forgot to tell you the other risk factors of UTI besides a female gender is presence of uncontrolled diabetes, presence of obstruction in the kidney passage because of stone disease, prostate disease, or any other kind of obstruction which produces swelling in the kidney. So anything anatomically abnormal in the urinary tract can produce the risk of infection. And other common thing is diabetes. Diabetes is a common disease in the country now, and that is said to be one of the very common causes of increasing the risk of UTI and complication that is there. So whenever you see a patient having recurrent kind of infection, we look at the sexual factors, etc. Is it a female patient or not? And is the patient diabetic? Is the patient having stone disease or any other obstruction which produces the risk of repeated infection? So UTI is treatable. It has to be treated with the risk factors in the mind, that is there any risk factor which can again lead to a recurrence. If you do not look at the risk factor, it may keep on happening, etc. There's a term called relapsing UTI, recurrent UTI. Recurrent UTI means 3 times occurrence of UTI in 1 year. Relapse means it has not been properly treated and it again came back within 1 to 2 weeks. That is there. That means there is something which we have missed in the diagnosis. We have given only antibiotics and not given thought to what has caused the UTI. So whenever I see a patient of UTI, we treat UTI with antibiotics in adequate duration based on upper or lower tract and look at is there any risk factor which can predispose to recurrence. And commonest risk factor that we have found is diabetes, stone disease, and incomplete voiding because of bladder obstruction, which could be because of prostate in males, sometimes neurogenic bladder because of brain stroke, they are not able to pass urine. So there are many other factors are there which can also produce a kind of incomplete voiding. So obstruction, stone, and diabetes has to be looked at when you have a UTI recurrence. Besides the female factor, female gender, where the local hygiene is very important, and postcoital prophylaxis, cleanliness, all the things are important.
Okay. And as you have told us that the treatment is treatable, so do not ignore it, because sometimes people also ignore that, the treatment must be so long. And what is your suggestion to the people who leave the treatment in between? They not treat the UTI
Completely.
fully, and they think that the pain is gone, the symptoms are gone, so I should stop having my medicines.
Uh, because UTI is, in most of the situations, UTI is not a very serious kind of complication. If it is cystitis, people get better in 3 to 5 days time, etc. But they have to look at the why it has happened, etc. What you said, that many times ladies don't go to the loo because of the social factors, etc. They think that the things are not clean. But if you are trying to hold the urine for a long time, stasis is there, and that could be a risk factor for recurrence that is there. People think that if they're passing urine in area which are not clean, they will catch up infection. But I think that is more of a kind of a thought process, that infection never ascends from whatever kind of areas which you are visiting, etc. That is probably spoken more in the Google, etc. That can happen. Cleanliness is important. So I don't think that that is a big risk factor. But risk factor is not passing urine unappropriate time, trying to hold the urine, etc., then there's a risk of urine infection, which could be there in females, etc. So we say that don't hold the urine in case you require to avoid the urination, and don't think negatively of passing urine in areas where you have sufficient cleanliness. So treatment is very important. And what happens that if you are taking the treatment for inadequate time, you have relapse. It is said that for lower tract infection, either you use a drug which requires only one time therapy, like the certain drugs like phosphomycin is said one sachet is enough. Otherwise, tablet to be given for 3 to 5 days. Earlier, people used to take it only for one day because low interact symptom. This kind of therapy should be given only in doctors who understand what to do it, etc. But for general people, it is said that for lower urinary tract symptom, take treatment for 5 days. For upper urinary tract symptom, that is like fever, take treatment for 7 days. And decide whether you need to follow up with the doctor or not. These days, it said that you don't need to do any urine culture or anything else. Only urine examination with a symptom complex is sufficient to make a diagnosis of UTI and take the treatment. Culture is only required when you is a complicated, that you are having fever. That means it is not a low urine tract symptom. Here you have to do a urine for culture. People give urine culture routinely in many situations without any idea how to give a urine culture. Urine has to be properly collected. This is the thing which is probably not spoken in most of the situations, etc. Ladies are never told how to give a sample of urine, and if it is not properly collected, it gets contaminated with the bacterial flora which is there over the genitals, etc. And that gives a false report of positivity, but without any kind of disease. So everything requires a proper kind of handling and interpretation. Treating only the lab reports, which is the common thing in the recent time based on the AI tool which is available, we treating unnecessarily many reports as UTI, which is not the case, and that is producing drug resistance. We are finding many times patients are getting urine report with every antibiotic resistant, and patient is looking apparently all right. So that is probably a contamination. Patient doesn't require therapy for that. So don't treat the report, treat the patient symptom, and try to combine all the things to make a correct diagnosis.
Very well said, doctor. Don't treat the report, treat the patient. And I think our viewers have will use this information as well. If their near or dear ones have UTI, now they know what to do and how to do. Doctor, any dietary precautions you would suggest to the people who have UTI?
uh, at least precautions which are mentioned to reduce the risk of UTI is taking enough water. That is, it is said that at least 3 liters of water, 2 to 3 liters of water should be taken enough so that you avoid. So that is just a kind of flushing effect. So whatever bacteria is there will come out. So water intake is very important. Then local hygiene, that is one has to look at, particularly females. That may be an important point. And for males also, for diabetics, this will be an important point because many people are on drugs like SGLT2 inhibitor, which produces glycosuria, or in the urine you have glucose, and if you don't keep the urine area clean, you have a risk of developing fungal infection. So local hygiene. And then if a lady is getting urine infection after this sexual activity, etc., you should, that is said that you should do a post coital voiding, that is after the sex you must pass urine at least one time. So that is a voiding kind of thing, that is prevention. And for males, it is said that if any patient is getting catheterization, you use a smaller catheter so that some amount of urethral secretion comes out. Otherwise, that produces a risk of infection. And then certain drugs are mentioned which are said to have some benefit, like cranberry juice. It is said that it has got a kind of bactericidal properties. You can use it, and probiotics, particularly in people who are having recurrent UTI. That kind of therapy has also been advocated to prevent the risk of infection. And estrogen cream, particularly in postmenopausal women, where the bacterial uh, vaginal pH changes, that has been found to have a kind of preventive effect. So there are many things which are done to prevent or ameliorate the symptoms. So these are preventive things. The most important thing is hygiene and voiding appropriately with 3 liters of fluid on a daily basis. And postcoital kind of voiding is must accept.
Okay, doctor. And doctor, we also have our live viewers watching this live, and there are some questions. There is a question that can vitamin C help to prevent UTI?
This is a thing which many people think that vitamin C is a drug which is having some kind of beneficial effect in fighting infection. It has not been found to have any additional benefit in urinary tract infection. If you are taking a lot of vitamin C, there is a risk of stone formation is there. Vitamin C produces a kind of oxaluria, oxalate stone. So it is said that small amount of vitamin D one can take. There is nothing to prevent it, but it is not found to be useful. So we see that a lot of patients are at this time are taking lot of antibiotics, not antibiotics, that the vitamins which are there, which are coming from US market. Good, but excess amount may be detrimental. And vitamin C, if you are taking too much, there's a risk of kidney disease. Not the urinary infection gets prevented, but the risk of stone formation is there. So you can take, but not with the idea that it's preventing urinary tract infection.
Okay, so as doctor said that you can take, but not a good idea to prevent UTI. And doctor, there's another question that can kidney stones increase the risk of UTIs?
That is a very important risk factor. That is one of the common risk factors we see in males as well as in females. And the common reason for the stone formation is because of inadequate water intake, increased amount of non-vegetarian food, and increased amount of salt. So we suggest the patient then who have stone disease with the infection to reduce the salt, because salt is somehow linked to increased amount of calcium excretion in urine. Reduce the non-vegetarian food stuff to some extent so that the uric acid is not raised and urine not that acidic. And third thing is to take enough fluid, etc. Because whatever water we take and whatever electrolytes, calcium is coming in the urine will get dissolved, because we have to explain the patient. We explain the patient that if you are making tea and if you add too much of sugar, etc., then something gets sedimented, etc. So you have to have an appropriate amount of fluid as well as the sugar to get it mixed. So water is very important. So solute will get only mixed with enough amount of water. And if you're taking enough fluid, it is likely to get mixed.
Okay, so water is important. Water intake is
Very important. And we say that take enough water. Nobody measures water to take it in. We tell that take enough water so the urine should look white. If it is yellow, means you are taking less amount of water. That means urine is getting concentrated.
Okay, so that's how we can, indicate that if the urine is yellowish, that means we are not well hydrated.
Yes.
Okay, doctor. Doctor, as we are discussing about UTI, you have told us about the precautions, the symptoms, the treatment. There is more questions from our viewers. The next question is, are UTI more common during pregnancy?
Pregnancy is a high risk situation of where if a urinary tract infection happens, it can get complicated. This is the only situation where you treat even the urine report. If the urine is showing a bacteria, you have to treat it. So asymptomatic bacteria in pregnancy, which is usually screened at 4 months, for 4 months to 5 months, we routine urine checkup is done, etc. And if bacteria is there, you have to treat the patient even if there are no symptom, because it is linked to increased risk of abortion as well as intrauterine growth retardation, preeclampsia, and all complications are mentioned to be high, etc. So this is the only situation in medical practice where the asymptomatic, that means there is no symptom, but urine is showing a bacteria, to be treated.
Okay, so that is the sign that that
Yes. But you routinely check it, etc. Even if patient not saying anything, you send the urine for culture. Otherwise, we never send a urine for culture in person who are not symptomatic. You should never do those tests unnecessarily, because then you get the test, you don't know how to interpret because there is no symptom, etc. So and then you start treating the report.
Right, right. Very well explained, the doctor. And we were also discussing about the age group, and you have already told us that the different age group can have UTI. There's a question that, sir, can children get UTI as well?
Yes, so it is said that if the children get UTI, first those symptoms are very, very misleading because child will never complain of any urine symptom or so. So any fever, unexplained in the child, etc., you need to evaluate for UTI because UTI is the common kind of infection after the respiratory tract infection. So you find that if you get a UTI in childhood, you have to evaluate with many tests, etc. You have to see that why the child is getting UTI, and they are which is not a kind of routine practice in adults, etc. With adults, the complications are less compared to the children because if they develop UTI, the scars can happen. So in a child, if you have a UTI, you need to evaluate by various tests, including some ultrasound and many other tests are there to see is any kind of kidney damage because of infection. So childhood UTI associated usually with some kind of malformation that is called, like, for example, vesicular reflux, which is called CACUT, that is congenital anomaly of kidney and urinary tract. Some anomaly will be there to predispose to UTI. In child, we find that like posterior urethral valve, the bladder is not getting drained properly, or urine is leaking back into the kidney. These are the situations where increase the risk of UTI in children. So any UTI in children needs more evaluation compared to the UTI in adults, particularly female, which is usually uncomplicated cystitis.
Okay, so that means they have to check on the
Yeah.
children if everything is
Uh,
well or not,
yes.
because
Yes.
it
It
is
may have a
totally
long-term consequence, yes.
right, right, doctor. And doctor, what are the risk factor if someone do not treat UTI for a long time? Are there any risk factor affecting their kidney or bladder, or is it like that?
Now, one has to realize that many times we have a kind of asymptomatic bacteriuria or pyuria. That is usually a kind of infection localized to the bladder. It by itself, it doesn't produce any damage. Damage will happen if you are giving too many antibiotics because the antibiotic produces many types of kind of new problems in the patient that is there. So if it is localized to the bladder and there is no symptom, no fever, no treatment is required, it doesn't produce any kidney injury. But if that spreads to the kidney, which is called upper urinary tract infection, then it can produce a kind of kidney injury, which can lead to kidney failure, and later on a kind of dialysis need may be required, which is the reason why in children we try to investigate in more detailed way because they live long and they have the risk of kidney injury related kidney failure requiring dialysis. So infection, if it spreads up, not treated, person will become serious, and even if treated, some residual injury could be there, and that is why it should be treated appropriately after investigation.
Right. So it should be treated appropriately. If you have already diagnosed UTI, you should better treat it. Doctor, as you mentioned about antibiotics, some people have this thing that if they have any kind of pain, they take painkillers. Any kind of thing happening, they take the medicines. Are taking medicines again and again can also lead to UTI?
No, the taking medicine may not lead to UTI, but antibiotics have a lot of other kind of complications which can be there. For example, the nitrofurantoin, which is a common drug which is used for treating cystitis. If it is used in a patient who has a kidney disease, creatinine say 2 or above, the risk of nerve damage, the risk of lung damage, the risk of anemia, which may not be understood that this is a drug effect, and which we find that very commonly this practice happens in the medical practice. People give the drugs without realizing that the drug is not working and drug is producing side effect. So we need to have a clear idea of what we are doing. Actually, many times we give it just without thinking of the consequences, and patients many times take on their own. Even if they have been advised to take for 7 days, they keep on taking for a long time based on their belief that is there. Most of the time, the side effects may not be there, but few side effects are very, very serious. And we have seen patients coming with serious neuropathy with a drug which was inappropriate in the setting of kidney damage that is there. So certain drugs are not given in kidney patients with damage. Certain drugs are given with a drug modification, and one has to have a good idea how long the drug is to be given and what drug is to be given.
Yes, and I think that's a very important question because we talk about people who don't take medicines, but never talk about people who, continue taking medicines because they think that fear of UTI and, they do not go to doctor. So what is your suggestion to the people, who overdose themselves by the medications?
So one of the things that people have to realize the presence of, say, few pus cell in the urine is not UTI, because we find that people are bogged down with the urine report many times are not reliable. But even if it is there, pus cell 200, 100, they think that 100 pus cell is dangerous and 10 is not like that. With pus cell is sign of inflammation. If you find that once you have a UTI, particularly in female, we find that pus cells are there lifelong. You keep on doing it, you keep on treating it. So people many times keeps on getting the treatment based on the presence of pus cell in the urine, and that is the commonest mistake that we see in our practices. Don't treat the pus cell, etc. You see that is there any symptom or not? Are you having a risk factor or not? If you are not having any symptom, no risk factor, no need to treat, etc. That is the way I try to explain the patient. Patients are worried that why the pus cell is not getting this over, etc. So inflammation can produce pyuria, etc. So presence of pus cell is not enough to make a diagnosis. And now we have a good kind of stick test available. There's a kind of multi-stick test where we have 2-3 parameters there together. If you have symptom, if you have pus cell or pyuria, which can be checked by a kind of a special stick test, and presence of nitrite, which is a kind of a substance which is produced by bacteria. If three things are present, etc., leukocyte esterase test, nitrite test, and presence of pus cell in the urine with a symptom, the diagnosis is clear cut. If any one of them are absent, you have to look at whether is it true UTI or not. So the tests are there. Only thing you have to get the right test and right place, right, go to right doctor. Don't try to self-meditate or interpret on their own, because we have studied this subject for 30 or 40 years now in practice, and still many times we get confused how to interpret the report. But people who may not have read it, they feel confident based on the AI tool of Google, etc., that is the final answer for that. So try to consult the doctors to get the right kind of suggestion. And antibiotics could be dangerous. Many antibiotics can produce a lot of side effects which may not be understood by those who self-medicate. So do not do self-medication. Try to consult the doctor to get the right kind of advice and right kind of overall health that we are aiming for.
Very well said, doctor. That do not self-medicate, and very well explained that how people think, by reading that, oh, this is happening to me and I should take this type of dose. Doctor, there's another live viewer question is there that can UTI cause back pain?
Yes, but if the UTI, if it is affecting the kidney particularly, which is called pyelonephritis, the upper urinary tract symptom, etc., then it produces pain in the back, which is called flank, etc. That is below the rib cage. That is a typical location of the kidney that is there. So pain is a symptom of inflammation in the kidney, and one of the reasons for pain is infection. But pain in the kidney could be because of many other diseases like kind of inflammation because of, say, autoimmunity like SLE, or any drug-induced kidney inflammation, which is acute intestinal affair, you have pain. So pain in the kidney doesn't mean only UTI. There are many other reasons for pain. It could be because of stone also. It sometimes could be because of cancer also. So do not attribute one symptom to one diagnosis. Symptoms are to be combined with the clinical setting to make a diagnosis that is there.
Right. So do not self-medicate, and do not self-diagnose your symptoms that this might be this or this might be that. Go to your nearby doctor if you have any kind of symptom. Doctor, any myths you would like to clear about UTI through this session?
The commonest myth in clinical practice is that presence of pus cell in the urine, the urine examination commonly done, is equal to UTI. We tell them like some ECG change is not equal to heart attack or heart disease that there. There are many reasons for abnormality that is there. So don't think pus cell is equal to UTI. That is the commonest thing we find in practice. With the doctors also thinking that way based on their training that is there. So presence of pus cell is not UTI. Presence of pus cell and bacteria is also doesn't require treatment if there are no symptoms except during pregnancy. Do not think that higher antibiotics has got a more role compared to the conventional antibiotics. There, people think that new generation antibiotics are much more effective than the old generation. I find that the old generation antibiotics which are not used that often is much more effective. For example, the nitrofurantoin, which is a very cheap drug, compared to fosfomycin, which is a costly drug for treating UTI. So I don't prescribe fosfomycin, which is 450 rupees a packet. I write nitrofurantoin, which is just maybe 2-3 rupees tablet, etc. So don't think that higher antibiotics or new generation antibiotic is much more effective than the old generation. You need to understand that right antibiotic is the right choice that is there. And duration is very important. Get yourself investigated and do not become kind of focus or rhinophobic based on the urine report that is there, etc. Because that is a common thing that I find that people want to see that urine should have no pus cell in the urine. If it is happening, nothing you can do for that. You have to treat the disease rather than the report that is there. I always tell the patient that we don't treat the report because we know that urine report will not become normal. But patient can remain normal if they are mentally quiet that is there, that there's nothing wrong. So they have to be reassured that urine report may have pus cell, but which is commonly treated as indefinitely for years the UTI, but it is not a UTI. So treat with symptoms, signs, culture appropriately with the common drugs which are cheaper compared to the costly drugs, and prevent it by the common sense therapies, that is taking enough water, post-coital kind of prophylaxis if required, or cleaning, remaining clean, hygiene is very important, that is there. Not to postpone the voiding need, etc., just because you think that is not a safe zone, because that may not help, etc. That is only a myth that it produces infection by many people have asked me that if they're passing urine, the reverse the kind of bacteria come through the stream into the body, but it doesn't happen that way, etc. So nothing moves that way, the anti-gravity, etc. I think that because I find that many ideas are many times bewildering. How to explain them that they may not be the case that is there.
Definitely, doctor, and very well explained that what is UTI, what are the symptoms, what are the do's and don'ts, precautions one should take, and we also have a live viewers question as well. Doctor, before we end this very informative live session, any do's and don'ts of UTI and any takeaway message you would like to give to all our viewers watching this live?
Uh, the urinary tract infection is one of the common infections in our day-to-day practice. That's most of the UTIs are lower urinary tract UTI, which is called cystitis, a bladder infection or the inflammation, which requires a short treatment. It doesn't require any culture also, because we know that those the conventional antibiotics like nitrofurantoin will work. For patients who are having fever with symptoms of urinary tract, they need to send a culture and get an antibiotic which is appropriate, because many times drugs are resistant for 7 days, and follow it up with the doctor. Why have they developed this infection? Prevention of UTI will mean that we need to look at the risk factor of diabetes, stone, obstruction, and voiding pattern, whether there is any obstruction that is there, to prevent it. And the dietary habit of taking enough water cannot be overemphasized. Try to avoid using the diapers. Many times we find that people are using diapers. Probably that produces many times a kind of problem in the urinary tract symptoms. That I said that draining bladder is much better than this kind of devices that we use for whatever reason. So I try to tell at least in pediatric, not to use diapers in case they are having UTI because like symptom, etc. And in adults, we say that in case they are not continent, to put a catheter and keep on changing it, then to pass urine in the diaper, because I feel that probably that produces the risk of UTI. And if you are on certain drugs which increases glucose in the urine, like the common drug that we prescribe these days is SGLT2 inhibitor, dapagliflozin or empagliflozin, which is the drug to be prescribed in diabetes for preventing heart, kidney, and other problems, can increase the risk of UTI if proper hygiene is not maintained. By the hygiene, we mean that area should remain dry, because if it is urine is containing glucose and is in contact with skin, it can produce fungal infections. So, and do not treat pus cell is equal to UTI. That is the thing that has to be understood, that do not chase the pus cells. That is what we say in our patients who are having fear of the UTI indefinitely present with the risk of kidney injury that is there. But not to ignore it also, that is there. If you are having a risk factor, you should get it treated.
So do not ignore UTI if you have UTI. So do refer to a doctor. And thank you so much, Dr. Ratan Jha. It was a very informative session, and I'm sure all of our viewers will definitely use this information, and their doubts are also being clear. So thank you so much for your valuable time, and it has been very informative session for our viewers, and we really look forward for many more such sessions in the coming time as well, Doctor.